Hello everyone! What's up, Doc Nana? It's SSBL Clinica Manila this time. At ang ating topic today is about warts. Yes, ano ba yung warts? Warts in Tagalog is kulugo. And it is also called verruca. And this is caused by human papilloma virus, okay? Which infects the top level of your skin. So this is highly contagious and it must be removed, most especially kung eyesore na siya and it is already painful and causing you discomfort. As now, as I talk, I will be showing slideshows and cases that I will present to you. So for those people who just want their warts to be removed in the salons, please be careful because baka hindi wart yan. Baka meron na kayong skin cancer or baka mga moles yan na kailangan i-biopsy. So you still really have to be very, very careful na you don't just let someone touch you who are not even medically inclined. You should be going to your dermatologist or to your doctors. So you don't just have them being removed by technicians. So anyway, mag-iingat po tayo. We should be very careful. There are some cases na mistook for wart, which is not wart. And it just so happened it's a cancer mole. Okay? So be very, very careful. And then in the salon, I've noticed, I did some observation. They just burn the top layer. They don't even get the tissue underneath. They just burn it and then let it black, like color black, and then they will just say, oh, it will just go away after some time. But that's not true. The more it will grow in a clustered form. When you say clustered, it's like cauliflower form. More. It's not single, it's more. So anyway, warts are hard, non-cancerous lumps on the skin. These are non-cancerous, so you don't have to worry. But they are eyesore, they cause discomfort and stigma and low esteem for some people. Now, caused by human papilloma virus infecting the top level of your skin, top portion, which is your epidermis. Okay, epidermis. Now, on the dermis, because we have skin, the skin has layers. I will show you in the slideshow. First, we have the epidermis and then we have the dermis. The follicle of your hair is the gauge of where the dermis is and part of the sebaceous glands, which is here on the third layer, and so on and so forth. So, with the wart, it's not only the top portion that is infected. That's where it grows first, okay? But it goes under and it goes deeper, and that's what you're supposed to remove as well, and which salons and technicians don't. They just burn the skin on the top, and that's not good enough. You have to go deeper, and you should use injections to remove it. Topical anesthesia depends on the client if they can tolerate the pain, but I would really prefer, if given a chance, to really inject on the tissue so it will be numb for several hours. But in our case, it takes exercise. So far the minimum is 30 minutes. That's how it is, because it's being done carefully. It's not to spread further and not to injure the healthy tissues around the warts. And mind you have to get what's underneath. They say it has no roots. Well, it may not have roots, but it has tissues underneath. It grows deeper. And yeah, for me, I call that roots, okay? Roots of the warts. Whatever they say. We are doctors, we know what we're talking about. So anyway, how do you spread warts? Could be person to person, surface to person, can spread from one part of your body to another, okay? Now, there are several different types of warts, which is the common warts, which can be found on your hands and your feet and anywhere part of your body. So we have slideshows. Just look into the slideshows, guys. So, and then we have the flat warts. Face and forehead are the usual places where they are always found. Now, person to person, how do you get warts from person to person with flat warts on the face? Beso-beso, cheek to cheek kiss. Like, you don't even know if you have an open wound on your face, if you have acne or pimples, and you just, you just pierce it, and then you go make beso-beso with someone with a flat wart on the face. You don't even know how it looks like. That's why I'm going to show you on the slideshow. It looks same skin tone as your skin tone. Sometimes if you're dark, it goes dark. But it's not, you don't even know if that thing is a flat wart because if you're not used to that, and if you're not consulted the doctor, then you would not know. So anyway, we have the plantar warts. This can be found on your sole and of the feet. And the filiform warts often grow on face. Filiform warts, this comes in either parang thread or clustered siya na parang mahahabang ganyan. Anyway, it's just being shown on the slideshow for you to have an idea. And then genital, caused by a different type of HPV than the others. The genital warts is stronger itong klaseng virus na to, which only attacks the genital parts. Now, for those who are polygamous or with multiple partners, have yourselves checked, and you might be having all these genital warts because it is transmitted through sex. Anyway, there's also subungal and periungal warts appear under and around the fingernails and toenails. Nakikita yan sa mga kuko. Most especially sa mga salon. Akala ninyo, you thought for a while after going to a salon, you got all this fungus here on your nail. Well, it could be a wart. And wart cannot be killed by any disinfectant, mind you. It's hard to kill warts. Not unless from your skin you really go deeper. And it is not a guarantee. Once you have a wart, you're carrying that. You're carrying the virus. And it can reoccur on the same spot or any other parts of your body. But then again, if your immune system becomes stronger, then this HPV in your body will become clear. Okay, listen to me. I will not repeat because I don't want my video to take too long. Anyway, so that is what I am saying. So anyway, here goes. We can also have mucosal papillomas, which is a mucous membrane, which can be found on your nostrils. Yes, sa mga ilong-ilong nyo sa loob ng ilong ninyo, inside or outside area of your nostrils. Not on top. I mean, talking about the whole of your nostrils. So anyway, I have copy here because I don't want to be missing some informations to tell you, because I don't want to take long here also on this video. And how warts spread from person to person is because you touched a person either with this warts. And if you have a low immune system, then you are most likely to get HPV. And if you have an open wound, and if you're prone to injuries, and children are mostly prone to injuries, and they get warts. Now, mind you, warts, if you don't want to have that removed, it can stay on your body only up to 6 months to 2 years. But by the time that you won't have that removed, then it is already spread all over your body. So I would suggest you have them removed. Anyway, for those prone to injuries, as I said, with low immune system, certain types of HPV that causes genital warts is spread only through sexual contact, and there is to prevent these things is by being vaccinated with an HPV vaccine. So there are doctors that dispense these things. These are, I think, the STD doctors, those infectious disease specialists, they do that. And for some doctors, why don't you just inquire to your doctor? And skin-to-skin contacts, especially on vagina, anal, oral, and someone who is infected, for those people who are sexually active. So because it is a skin-to-skin, you rub the skin. You know how sex works, you know. HPV vaccine is given against strains of HPV genital warts, as I mentioned. How warts spread to other parts of your body? If you pick or touch or scratch on the part of your body, then do the same in the other parts, then you're spreading the warts of, you know, all over your body. So shaving. If you shave your wart and then you shave your other parts of the body and you get cut here and you have another cut here, then you're spreading the warts by yourself. And don't scrape the wart. Okay? Now, how warts spread from surface to a person? If someone infected person touches a surface and then you have an open wound and you have a low immune system, then you get warts. And if sharing personal items like shaves and towels, especially for those people who loves to use towels outside in public places, in hotels and motels and what other tales. So anyway, you just have to bring in your own towels. In my clinic here, we give and dispense patients their own personal towels. They buy it and they bring it home and they throw it or whatever, they have it laundered or you use it. So anyway, be careful. HPV can be hard to kill with disinfectants. They don't just die. Anyway, getting HPV from wet surfaces such as pool areas, shower, sauna, swimming pools, shower room, towel or infected person has used. Okay, don't walk barefoot, Don't walk barefoot on public places. That's where you get warts, especially if somebody with warts walked on a place, where you're walking on, and you have wounds on your feet or soles, or you have a low immune system. Okay, now, walking barefoot, okay, you don't walk barefoot. Okay, wear socks, wear slippers, wear shoes. Here in my clinic, no one is allowed to bring in outdoor footwear. You have to wear our disposable slippers. Okay, how spreading warts can be prevented. To prevent person-to-person spread, clean your hands regularly, disinfect cuts and keep them clean and dry. Don't touch other people's warts. Wear socks, use condoms, wash the nail file used for warts. Don't pick at warts, don't peel. To help prevent warts from spreading to other parts of your body, don't scratch or pick at your warts. Keep your warts dry. Try to avoid your warts while shaving. Consider covering your warts. Don't use tools like nail file or nail clipper on both your warts or unaffected skin. So to help prevent surface-to-person spread, wear shoes in public places. Places like pools, gym, yes, locker rooms, sauna, and showers. Clean any surfaces that have come in contact with warts, whether your own or someone else. Don't share towels or other personal items. Now, with the beauty parlor, yes, sorry. For those people, they like to use the comb on the beauty parlor. If you remember right, I had a patient with a scalp wart. Yeah, that's one way you get from the salon, using public tools for their hair. And if your hands have touched something like infected surfaces, and then you scratch your scalp, that's where you get your warts on the scalp. Okay, mind you, everyone, most warts go away in 6 months to 2 years. By then, it's not advisable. You have to have it removed. By then, it's already spread all over your body. There is a salicylic acid that can be used to remove it, but it takes weeks and weeks and months before it will go away. But still, it cannot burn what's inside, which is already the tissue that has warts underneath your skin, which is the part of the dermis. Then still, you need the doctor to have it scraped out, okay? Now, there are treatments: freezing the wart by cryotherapy, burning, chemical peels, laser, and surgical removal. But all of this, you have as seen on the screen, it has to be removed because the warts go deeper, down to your down to your dermis. So, you have to have that removed. Salon people cannot do that because they cannot prescribe medicine after that. Can they prescribe antibiotics for you? I don't think so. So, don't let anybody just remove your warts. Have someone, professional doctors, to do it for you. So anyway, this is highly important. I'd like to tell you that getting rid of the wart, listen to this, getting rid of the wart doesn't cure the HPV. Okay? Once you have the wart, the virus is in your system. That cased the wart, therefore it can come back. Same spot or other different parts or same spot. Eventually, your body will clear the HPV virus. It's possible to get HPV and warts more than once. You can get rid of all this HPV virus in your body if your immune system becomes stronger. That's it. So I hope you learned something today. So be very, very careful with sharing towels and shaves and all stuff. And refrain from beso, kiss, kiss, kiss. I don't like people kissing me, because I'm not even sure of what they have on their face. It's just being extra careful. I don't want, these things. So here, now at SSBL Clinica, I hope you learned something, and I hope I was able to share to you something that is very, very important. So try and check your body. Go see your dermatologist.